If you're new to this podcast, my name is RuthAnn. My husband Lance was a service-connected, disabled U.S. Navy veteran. He was sick for 25 of the 27 years we were together, and the last 12 years of his life, I was his full-time caregiver. This is an episode that you're going to want to hear. Today, we're going to talk about intuition, that gut feeling. We all have it. That feeling you get when you just know something is off, that gut feeling that you can't explain logically. And that's why so often we ignore that gut feeling because it defies logic. But what happens when you don't trust that gut feeling, when you don't trust your intuition and something goes terribly wrong? That's what I'm here to talk about today. I'm going to tell you a story. But first, I need to give some details for the background of the story. In 2006, my husband Lance was diagnosed with Untitled Chapter disease. This was his second diagnosis. He'd already been living with a rare blood cancer for over a decade. This new diagnosis meant that he needed a port for chemotherapy, and that port ended up being used for many things. It was used often for IV antibiotics, and it was used for fluids because he had diabetes insipidus, which is the water diabetes, not the sugar diabetes. And he constantly had problems with dehydration. So that port was very useful in administering fluids. If you don't know what a port is or a portacath, it's a small chamber inserted into the chest in the upper part of the chest, and it's connected to tubing or a catheter that in Lance's case, that tubing went up and connected to a vein in his neck. And it gives a direct line into your bloodstream, and it allows medications and fluid to be directly administered into your blood. Lance was what the nurses always called a hard stick, meaning that he didn't have good veins, probably because he was always dehydrated, and it would take multiple pokes just even to get blood. And this port was kind of a life-saving thing for him. And it definitely improved his quality of life because then he didn't leave the hospital with black and blue arms. Like I said, this was in 2006 when the port was implanted. He had this port for many years. 13 years later, January 2019, he was admitted to the hospital with yet another infection. And when they're checking for blood infections, when you have a port, they're supposed to pull blood from the port, and they're supposed to pull blood from a vein outside of the port. Well, at this emergency room visit, they only pulled blood from the port, and it came back infected. So Monday, Tuesday, Wednesday, and Thursday, each morning we met with the medical team, which consisted of sometimes the attending physician. Most often it was just the third-year resident, the second-year resident, and the student. And that third-year resident was in charge. He was trying to convince us that the port needed to come out because it was infected. And I argued with him Monday, Tuesday, Wednesday, and Thursday that the cultures had not been drawn properly, and you couldn't say definitively whether the port was infected or not because the cultures from the arm were not taken until after antibiotics had been started. But he persisted, trying to convince me that the port needed to come out. Now, something else that you probably don't know, especially if you're new to this podcast, is that I became Lance's legal guardian 10 years before he passed away. So I was the one who signed off on everything. I still asked Lance his input because it was his body, but ultimately the signature was up to me. Because that port had been in for 13 years, I was concerned about scar tissue. And that was what I argued with that third-year resident about every single day. I was also communicating with one of the nurses on the infectious disease team, and he was relaying my concerns about the scar tissue to the infectious disease doctor. I wanted to make sure that everything was done to protect Lance. And the third-year resident was also communicating with that infectious disease doctor. On Thursday, the fourth day of arguing, the third-year resident admitted that he had been on a previous team when Lance had been hospitalized with another blood infection, and I wouldn't allow them to take the port out at that time either. They were sure that it was infected, but again, there was no definitive proof because the cultures were not done properly. I had spent the previous 4 nights in the hospital with Lance because the last few years when he was alive, I stayed with him at the hospital all the time, only going home in the evenings to take a shower, possibly to take a short nap, and then I would head back to the hospital, spend the night with him so that I would be there if he woke up, and so that I would be there in the morning when the doctors did their rounds. To say I was exhausted is an understatement. Day 4, arguing with the third-year resident, still trying to convince me that this port needs to come out. And I was tired of arguing with him. And I said, I want to talk to Lance's oncologist because he's the one who diagnosed Lance, and I trust him. Because it was Thursday, it was clinic day in the oncology department, and I know what clinic days are like. They're crazy. The last thing a doctor needs is to be interrupted to talk to a patient's wife, but I needed to hear it from him. That third-year resident assured me that I did not need to go down to the clinic to talk to his oncologist. He would relay my fears to him about the scar tissue. It wasn't long after when I received a phone call from the oncologist saying Lance's port needed to come out. But Lance was feeling good by then. He'd been on antibiotics for a few days. And we had tickets to see the Boise Philharmonic the next night. Lance had never been to a classical concert, and we were both really excited about it. So I asked the doctor, can we do it next week? He's feeling good. Let us go to the concert. This is quality of life for him at this point. And the doctor said, no, he's already here. Let's go ahead and do it now. It needs to be taken out today. Why was this so urgent? My gut was telling me, don't do it. But I trusted the oncologist, and that third-year resident knew that. The procedure was performed that afternoon by a physician's assistant, and the port came out, but the line, the catheter, was stuck. The next day, Friday, the vascular surgeon was called, and he attempted removal of the line. What was supposed to be a 20 to 30-minute procedure, simple procedure, they do these all the time, turned into 2.5 hours with extra staff called in to assist. They couldn't remove the catheter, the line directly into Lance's bloodstream, because there was too much scar tissue. The third-year resident came out to the waiting room where I was sitting by myself, and he took me into a private room. He told me that it had been unsuccessful, and he was so distraught, apologizing to me. But because he was so distraught, I comforted him, but he hadn't told me the whole story. Lance always had a follow-up visit after a hospitalization. It was standard procedure, and it was usually about a 1.5 to 2 weeks after he was discharged. This time, his follow-up appointment was with the infectious disease team. I was furious when we entered that room with the doctor and nurse. How could they have let this happen? The scar tissue had been my concern all along, and they knew that. But the doctor stopped me and said, we were really surprised to learn that you had gone ahead with the procedure because we had recommended a vascular surgery consult prior to attempting removal of that port, and we relayed that to the team, meaning that information had been passed on to that third-year resident. When Lance was hospitalized, I didn't have access to his medical records for anything that was happening while he was in the hospital. I relied solely on the information that I was given by the team. So when we got home after Lance's infectious disease follow-up appointment, I looked up his medical record, and there it was, plain as day. A note from the infectious disease doctor recommending a vascular surgery consult prior to attempting removal of the port because of the concern for scar tissue. And it was in there before the procedure was even attempted. How many providers knew about this recommendation and didn't tell us? I met with the Boise VA director, the chief of staff, the doctor who was the head of that team of residents, and I requested a social worker be present during that meeting to advocate on behalf of Lance and me. I was told during that meeting by the chief of staff that the VA did nothing wrong. I'm not denying that Lance was sick. He was, but he was also a human being, not an object as he was treated. And I don't understand what gives a medical professional, or anyone else for that matter, the right to make a life or death decision for another person. This is how our sick and disabled veterans are treated. If the government doesn't want to spend money on our veterans to treat the medical and emotional health problems that they suffered while in service or because of service, then stop sending them to war and stop exposing them to environments and toxins that so negatively affect their health, and stop treating our veterans like they are property of the United States government. They may have signed up for that when they joined the military, but once they get out of the military, they are free. They are not property of the US government. You don't own them. We ended up putting Lance on hospice a few months after that failed port removal because he had a direct line into his bloodstream, which meant he was going to be more susceptible to infections. And he was hospitalized a couple of times after that. And both times when he returned home, he was black and blue from his knuckles to his shoulders because he no longer had a port, and he needed so many sticks because they could never draw blood and they could never get an IV inserted. He cried the last time he needed to go to the hospital. And he said, I don't want to go back. I don't want to be poked anymore. And that was when we decided to put him on hospice. I live with the knowledge every single day that I did not trust my instincts, that I did not trust that gut feeling that said, don't do it, because I thought I could trust a third-year resident who had taken an oath to do no harm. How many people knew about this beforehand but did nothing? How many people covered it up? I have PTSD from the VA, and I'm not even a veteran. I lost faith in a system that is supposed to protect our veterans. I lost trust in the medical community because an oath to do no harm is apparently meaningless to some who take it. I do want to say that not all providers are bad. Lance had so many great advocates at the Boise VA Medical Center, so many people who cared for him and who made his life so much better. There's a lot more to this story, but the reason I wanted to share this part of it is because I want people to be aware of what happens, and I want people to trust that voice, that feeling, that gut instinct, that intuition that is telling you what you should do, that's telling you something isn't right. Trust that voice, trust your gut, trust your intuition. Advocate for yourself and advocate for our veterans. They sacrifice so much to allow us the freedom that we have. Please share this episode. Share it with everyone. Nobody was held accountable for what happened to Lance. There was never any justice for what happened to him. And that is so wrong. And there are so many veterans who share a story like that. So please share this episode. Let's advocate for our veterans. Let's try to change a system that does not want to change, a system that should be protecting our veterans, that should be caring for our veterans, but that doesn't always do that.